Now talking about beta blockers. Yes, so beta adrenergic receptors, they are also sympathetic, but they have different effects. Again, we have again selective and non-selective blockers. Yes, beta blockers which are non-selective block both beta 1 and beta 2 receptors, and selective only beta 1. I want to pay your attention on that all the drugs from beta blocking group have the same endings with lol. Propranolol, bisoprolol, nebivolol, metoprolol, and so on. So you can remember them easily. Okay. Talking about their mechanisms, I will check if we have it further. The mechanism, yes, we have them. So, talking about their mechanism, they have 4 ways to effect on the blood pressure. Firstly, they suppress the vasomotor center because, as we remember, in vasomotor center, beta 1 receptors, they are responsible for stimulation of vasomotor center. So if you block, you will suppress the action of vasomotor center, so reduce the action of sympathetic nervous system. Okay, weakening the heart. Why? Again, because beta 1 receptors we have in myocardium, and from the myocardium we have the cardiac output, yes, from the contraction of myocardium. So reducing the activation of myocardium, we make less cardiac output, so less blood pressure. Reduction of production of renin. This is in kidneys, exactly in juxtaglomerular apparatus in kidneys, which is responsible for the release of renin, and by blocking of, again, beta 1 receptors, a little bit beta 2, but beta 1 like more effective. By blocking all these receptors, we have less release of renin in juxtaglomerular apparatus, so we will have less renin, angiotensin, and aldosterone system activation. And in the presynaptic membrane, which I just erased, which you remember, yes, the beta receptors which were on the upper side, yes, beta 2 receptors, they stimulate the exit of norepinephrine from the presynaptic membrane, stimulate, yes. So if you will use the beta blockers, by which you will block these beta receptors, so there will be no stimulation of release of norepinephrine. So it will be less release of neurotransmitter through the presynaptic membrane.